All right, nice and gentle breathing. Just stand up nice and straight. How'd you get that birthmark on your right arm? What's that?
I'm not sure. It's been growing, but yeah.
You said that's been growing?
It's growing a little bit.
Has anyone else looked at it?
My dad's a dermatologist, so I think it's he's looked at it. He's looked at it. He said it's normal.
So a little bit of a high left shoulder. Your ears are very close to similar, but the high left ear, high left shoulders are just a little slightly in this way. Nice and straight up and down. No deviations, no rotations, external or internal. All right, looking at bottom, good. Arches are intact. Slightly higher left hip. High left shoulder, high left ear. That's good. Okay, now close your eyes. Forward to backwards, lean right there. No side to side. Looks stable from here. Just a slight increase in the thoracic curvature here. Didn't really see this from the front at all, but you're about an inch forward in that direction, so that indicates a loss of the curvature here. And that's why this thoracic kyphosis is increased here. But rolling is the best thing that you can do for this. And your conscious awareness of your posture is the most important medicine. So like the more that, I know that sucks right there, right? It's weird, but if you keep practicing it, it won't be that weird. It'll feel normal after a bit. Pelvic rotations here. So you're gonna feel my fingers on the back of your hamstrings, sliding up to the glute folds. This looks pretty even here. We're a little bit lower on the right. That means your right hip is back like this, and your left hip is forward like that. And then the right one is just a little bit further in. So that means your right hip is like turned in like that, internal rotation. Checking for hypertonicity of the glute muscles. There's a little bit more hypertonicity on the left, which would indicate that this hip is the primary one that needs to be adjusted. Good, looking for any curvature of the spine. No rib humping here, that's good. Come back, one SI joint, one sacrum contact. Go ahead and bend forward like you're gonna touch your toes again. Good move right side now, go ahead and touch your toes. Significantly more movement in the right SI joint than the left. All right, we're here with Dylan today, collegiate soccer player. Hamstring pull in the spring, and then since then has led to increased stiffness, hamstrings, low back. You're working hard at it, you're rolling it out, you're stretching 20 minutes every morning, perfect medicine. No crazy like pain, but consistent everyday pain. Or this is your first chiropractic adjustment ever. How do you feel about that? How do you feel about getting adjusted today?
Excited.
Okay. Now, let's see what's happening in here. Any pain, discomfort, tension here?
A little bit, yeah.
How about left side?
A little, not as much.
Not as much. Right, left. Which one more?
I feel like a little left.
Positive compression on the right, and then no compression on the left with SI tenderness. And let's see what the lumbar says. Any pain, discomfort, tension here? Any pain, discomfort, tension here? Okay, the lumbar spine is relatively clear. Let's just verify that with one more lumbar test. Go ahead and lift your right leg up in the air. Good down, good sequence of contraction there is to the left side. Good down. Okay, lumbar spine is firing the way that it should as well. So, no falls on your butt? No nothing that where you hit your butt real hard? Okay. I'm going to follow the coccyx down to the first segment. We're going to test this ligament right here. Any tenderness here?
Yeah, some tenderness.
How about here? Okay, that's good. Left positive. How about right side here? Both sides equally or one more than the other?
Maybe a little more. I don't know.
Okay, that's okay. That just means it's close. All right, let's start by releasing this ligament here. So we're going to contact that ligament here. We're going to find the direction of resistance. Yours is up and in. Good. And we're just going to hold that segment, hold this tension while we find the corresponding tension in the occiput here. Everything's connected top to bottom, Dylan. All right, how's this feel? Is this tender still?
It's not too bad.
A little better, right? All right, so I'm going to crack a couple of things here today. We're going to start off in the thoracic spine, then we'll get the sacrum moving, then I'll take a look at your cervical spine. Then we'll do a decompression maneuver. We'll see how that feels. We'll add it all up, and we'll see what to do next, okay? Okay, nice, gentle breathing. Let's practice one first, just so you can feel what it's like. You're going to take a deep breath in. Good. And then as you breathe out, I'm going to follow your breath like that, Dylan. Good. As you breathe out. And then at the end, we'll just give a little push, okay? Good. The shoulders sink in. Good. Let it all go. Here. Good. Shoulder. Good. Nice.
That hurts.
Yeah, it sucks, right? This is all your rhomboid muscles right here. I'm just trying to keep your scapula on top of your rib cage. As your shoulders like slump forward, it pulls your scapula out like this. Not right now, but just like when you're in that posture, and that puts a lot of strain on these muscles. Is it equal to right to left, or is it worse on the right?
Worse on the right.
I'll adjust your shoulder, which will help. Right here, I'm gonna lower this down so I can see your SI joints. Good. All right, Dylan, let's get this adjusted here. We're gonna bring your shoulders are coming up like this, your hips down like this, and then I'm gonna push like that, okay? All right, let's give it a try. Deep breath in and out. Good. Sinking and letting it all go. Let the shoulders drop in. Good. Good. That's perfect. Breathing. Good. We're gonna bring this hip down just a little bit. Good. Pushing back down in that direction. Let this go here. Good. Perfect. Playing your back. Good. All right, so just like the other adjustments, Dylan, I'm going to bring your head over to the side, and then we're going to just follow the breath as you breathe out. We're going to go like that, and then we'll give a little push, okay? All right, nice and gentle. Good. We're going to bring this down here. Good. Gentle, 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 gentle. Almost. Not quite there. I got to go a little bit further into it. Let the shoulders drop in here. That was better. Good. The head and shoulders go. Serious. Okay, nice, gentle. Good. 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 Just like the other adjustments, all you have to do is breathe. I'm gonna put that like that. You okay with that? Good. We're gonna go like this. Good, and then as you breathe out, I'm following your breath. We're going in this direction, and then I'm going to pull like that at the end, okay? All right, nice and gentle. Go ahead and take a deep breath in and out. Good. Feel it all the way down?
Yeah.
Probably in like those muscles that are tight in the shoulders there. Is that where you felt it, in the top of your shoulders?
Yeah.
Those tight muscles?
Yeah.
That's okay. Hey, that's a good question. You're the only person who's ever asked that question. Surprisingly, I've done this thousands of times. You're the only person. That's awesome. The reason is because it puts your lumbar spine in the most mechanically optimal position. So it takes tension out of your spine so that when I pull, it just can go all the way through. So there's nothing resisting it. So like when your hips are down like this, when your legs are down, your hips are tilted more like this, and that raises your lumbar lordosis. So, but when it's up, it flattens the lumbar curve, which increases the vector. You know what I mean? The vector is a straight y-axis pull. So if it doesn't have to like roller coaster up and down through the curves, it can go further down. I need more storm runner and less candemonium. Basically, what it comes down to. Let's see. How's it feel so far?
Feels good.
Okay. Any increase in tightness, stiffness, or anything like that? How do your hips feel?
It feels interesting, like up here, my upper back.
Yeah.
My hips feel like pretty good. It's hard to tell.
Yeah.
Like,
so we'll know it tomorrow morning.
well,
Yeah.
I feel like it feels pretty good though right now.
Good.
Should it feel like super loose right now?
Yeah, absolutely. Yeah.
I feel like it does feel pretty
Good. Nice. Your shoulders are tight. I mean, it's gonna feel good. All right, put your hands on your hips again.
What was that small crack?
Yeah, that was right here. That was your glenohumeral joint. See, the thing is that all these cracks are gonna sound smaller for you because you have so much muscle around the crack. You know what I mean?
Mm-hmm.
The bulkier the muscle, the more dense the tissue
Mm-hmm.
is in between us and our ears and
Mm-hmm.
the cracking sound. So, good. Little pull here. Good. Okay, this was a really good adjustment. Everything that I wanted to cracked.
Mm-hmm.
Okay, so the next 2 days you'll feel that. But if not, call us on Thursday and I'll try to see it. We'll
Mm-hmm.
put you in somewhere
Mm-hmm.
and see you one more time before you leave.
Okay.
And sometimes it needs to, but this hasn't been happening for that long. You know, it's less than a
Mhm.
year, so I think that you'll respond well to this adjustment
Mm-hmm.
and feel better. Roll a little bit less. Watch your posture. Do those things. You'll need me a lot less in your future for sure.
Okay.
But also, you're a college athlete, so you know
Okay.
you're using your body. You know what I
Yeah.
mean?
Yeah.
It's a lot,
Mhm.
and like you're already noticing, like when you're 10, your body heals everything instantaneously. But the older you get, that's why there's professional athletes are all in their 20s,
Yeah.
maybe 30s,
Yeah.
depending on the sport. Like, it doesn't last forever.
Yeah.
So,
I saw the new quarterback documentary on Netflix. Did you see that? It was with some NFL quarterbacks, and they all like have like chiropractor, like muscle therapy, like people that they see like every week to like, because they're just in the season. It's just crazy compounding.
absolutely.
But
They've all got chiropractors for sure.
Yeah. Thank you. This
All
is,
right.
yeah.
You're welcome.
Yeah. Thank you.
Yeah, you'll feel better.
Thank you very much.